Hello and welcome back for episode 21 of the Noobie Dentist Podcast. I'm your host, Dr. Omid Azami. And in this episode, I'm with my good friend, Dr. Rahul Shah, who is an excellent young dentist practicing in Toronto, Canada. In this episode, we nerd out on a lot of dental topics, so I hope you guys do enjoy it. We talk about his journey from qualifying as a dentist over in India and coming to Canada and getting requalified at the University of Western Ontario. And we talk about a lot of other cool topics, so I hope you guys do enjoy this episode. In terms of some podcast housekeeping, I just want to thank everyone for their continued support and referring this to their friends and colleagues and classmates. The download numbers have been continually growing and are quite strong, and I'm really happy with that. We've been downloaded in 48 countries around the world now. Shout out to whoever downloaded this podcast in Uganda. I do hope you guys enjoy this episode, and I'll be back with more episodes in the next couple of days, and we'll just jump right in.
Hello and welcome to the Noobie Dentist Podcast, the safe place for newbie dentists to connect, collaborate, learn, and grow. The Noobie Dentist Podcast aims to provide high-quality and high-value content for all the newbie dentists out there. With your host, Dr. Omid Azami.
Hello and welcome back for another episode of the Noobie Dentist Podcast. I'm your host, Dr. Omid Azami, and I'm excited to be here with my good friend, Dr. Rahul Shah, a fellow local dentist here in Toronto. We met over Instagram, and it's been great. We've had a few dinners together, and we've met, and we've talked a lot of dentistry, and I took some convincing, but I finally got him to come on the show and spread his knowledge. He's a very purist, a dental purist, I like to say, and he likes his dentistry, loves his dentistry. And he's definitely made me a better dentist over a few conversations that we've had. So I'm excited to have him on, and so we can spread that knowledge for the rest of you guys so you can also learn from him. So Rahul, how are you doing today?
Not too bad, man. Thanks for having me, man. I still don't know why I'm here, but it's all good. First of all, before we start, it's like you're doing an amazing job with hosting this podcast and kind of being the brainchild of this podcast. It's absolutely amazing, dude.
Thank you. I really appreciate it.
Relatable. Like honestly, like last week or 2 weeks, like when you put on Bruce Freeman's podcast, it was like that guy was dropping so much knowledge. Yeah.
Man, he's good. That episode has been so popular. That episode was super popular.
Honestly, like that would have had the charts. Downloads or whatever. But.
Yeah, he's been great. And he's been, Bruce did a great job. He campaigned it pretty hard. So he got the message out there. Awesome. So I wanted to touch on a few things with you, a few topics at the start, and then I kind of just want to nerd out a little bit and talk some dentistry afterwards. Sure. So obviously you've had a pretty cool journey like thus far, like in your early career. From my understanding of our conversations is obviously you graduated with your BDS over in India, and then you came over to Canada. And did the sort of equivalency process, like doing the 2 years at University of Western here in London, Ontario. So I just want to talk about that journey a little bit initially. I know we have some listeners outside of Canada, and we're in such a globalized area. Like even myself, I'm moving to Australia now, so a lot of dentists are mobile. We're moving around, and it's a pretty cool profession in that sense that we can have some of that flexibility and with some, obviously not easily, but with some work, we can sort of work in other places. So you made the big move over to Canada, and I just want you to, talk me through that like transition year, what it took, and then what your experience was when you got into dental school. Because obviously you're sort of put in, I think, are you in the same clinic as like Canadian like dental students, or you guys have your own separate sort of clinic at the start when you start at Western?
So the way it works out is once you're kind of selected to be a part of the school and go to the school process, you pretty much do like summer school for I think about 4 months. Get your skills up to date. They kind of go through all the more relevant topics for teaching and the protocols for school. Like, hey, you know what, you guys have, when you guys transition into third year, you guys got to do this, and that's how class is going to be. And it's just like kind of an orientational, pretty much extended orientation, I would say. And obviously they have a couple of tests and this and that. But once you kind of make that transition into third year, you're with the regular students out there. So it is a major jump for, I would say, most of us. This is exactly what, I mean, I've learned from my own experience in and people are like, obviously people are coming in from different countries and they have their own little comfort zones, and they have their own little shells that they like to stay within, right? And I just feel for some reason I don't think you will learn as much, or you will enjoy that experience of actually being in school, or if you're not interacting with the others. People love to be in their own little shells and in their own comfort zones, and hey, you know what, like, oh, you're Indian, oh, let's just kind of hang out forever. Like, no, it doesn't work like that, man. Like, it's like get out of there, get to know people. They probably know way more than you will ever know. Work on the soft skills aspect of it. It's not only about getting the grade, or it's not only about getting the like your marks or whatever, and getting out of school and getting the degree. No, it's not about that piece of paper.
The journey's got to be fun.
Yeah, it's about the journey, and learn from other people, learn the culture. If you've kind of move to a different country, I'm not saying like completely forget about your old culture. I still will eat butter chicken all day, every day. But it's like,
integrating.
Just integrate yourself into society, man. Like it's very comforting to be staying in your own little like your 5 people group, 6 people group. Hey, you know what, we're all Indian, we're all we like to be in our own little shell, and we're not gonna we'll progress with interacting with each other. No, it's not about that. But that's what I found, and that's what I learned. And like my best friends essentially are people from the regular batch.
And it must have been pretty cool, because I can imagine, obviously, like you're stepping into like 3rd year there. So those guys are just entering clinic, whereas you're already like a licensed dentist, right? You've had experience. So are people like looking up to you, or like coming over to you and be like, man, how are you like doing this, or how are you doing that? Like, is that cool to have that sort of interaction?
It is, but like I was pretty much essentially the same age as these guys, right? Like the regular batch. I kind of graduated in 2010, and then when I moved to Canada, it was like 2011, 2012, and then I was kind of considered the same age group as these guys, but I would say, like, just because I was more approachable, or just because I was kind of reaching out, with the rest of my batch, I think I was more. I probably was a better person to kind of guide people and help them out in whatever way I could. I mean, obviously I didn't have like tons of years of experience from back home. Like I wasn't like people who were my, people who were in my batch were like, had like 20 years experience, and they had their own practices and their own little, like, they had their own show going and in their own countries, Iraq or Iran or whatever. Yeah. And then that transition, I can understand is harder. It's so hard, so much harder, right? Because like, I don't know how many years they took to kind of get into school, and there are so many people out there who are still trying to get into school, and like they have kids, and like when I moved, I had no liability.
Perspective is crazy, yeah. Like they're working,
exactly. Like I had no kids to take care of. I had no wife, nothing. But I see people struggling, and they're struggling for like 3-4 years, and it's still not happening for them, and still not and they're working Tim Hortons and trying to make ends meet, and it's so hard, and but like coming back to what you asked me, it's like like I was more approachable, I would say, but I would say I didn't have as much experience as these, like the other kids did. Like I didn't come with like a ton more, maybe in oral surgery, just because like if you consider India as a whole, and if you consider the dentistry I was practicing there, it was all symptom based, right? Like it was only like, hey, you know what, my tooth hurts, take it out, that's it, and maybe in oral surgery I was more proficient than the other people, but overall, like it was a learning process every day for me as well. So I would say that transition was like it was amazing for me.
That's great. And then so when you graduated, you went and did a GPR at Mount Sinai, is that right, in Toronto? Mm-hmm. So that's cool, because I mean I've talked to a few young new grads in the States, and we've had this sort of debate of like GPR versus like private practice or like the AEGD kind of thing. So what was your experience? What was your first of all, what was your like thought process of like when you graduate, like do I just start working in private practice, or Do I take a year and do a hospital-based residency? Like, what were you hoping to get out of it? And after that 1 year, like, what was that experience? Do you think it was worth the year that you put into it?
Yeah. So the way was, I really wanted to get into residency. I wanted to get into a hospital-based program. I wanted to, like, my kind of thought process is, if I don't know everything, I don't want to do it. Like, I can't, like, if I need to know pretty much 80% to 90% of the procedures performed before I actually kind of get into it. And that's just the kind of person I am. I'm just wired like that. But, I would say that's the reason essentially why I applied for GPR, and I was fortunate enough to get in. And I would say Mount Sinai is one of the most intense and labor intensive, I would say, and most grueling residencies out there. It's hard to get through. Like, there are multiple personalities out there which you got to deal with. It's just after hours clinic is so taxing on you, and as physically, emotionally, mentally, and in every aspect, right? So it was a great program. I learned a lot from it, but it was, like I said, it was taxing. It was tiring. It was like, because you're pretty much on call every alternate day to every 3 or 4 days, and you're working from like 8 to 4 ish. Those are your hours of regular work, and then you're on call, and then you're doing your pager is going off at like 12 o'clock, 1 o'clock, 4 o'clock in the morning, and you're running for you run in the hospital, and you're pretty much there till 7, 8, because you're probably fixing a jaw fracture, or you're fixing like someone's problem with Toronto is people love cycling, and that's awesome, but some people don't realize that there are train tracks as well, like the street tracks.
Oh man.
And then they flip over.
That's common in Melbourne as well. It happens a lot.
It's insane, man. And these guys are like zooming past, like obviously there are like dedicated cyclist lanes and stuff, but these guys are like kind of just flipping over their handlebars and falling on their faces. So that's essentially what we're like treatment planning and getting in there, and like putting all these avulsed teeth in and splinting them, and at like 4 o'clock, 5 o'clock in the morning. So it's a little taxing, but it's a great experience. I would do it again for sure. I would do it again. But the only thing that I learned, the two main things that I learned from the residency was, number one is you develop thick skin. You learn to take criticism. You learn to take feedback. Like Bruce Freeman said, it's insane. Like the amount, like if you're like, very easily offended and like, hey, you know what, this has to be politically correctly said and this and that. If you're kind of that kind of person, GPR is not for you, at least at Sinai, right? But it's like you take it. If you don't take it, you don't take it personally. That's it. Like, you go on, you take it, you learn from it, and you move on, right? And the other thing that I learned, I would say, is restraint. And that is extremely important in my practice. Like, I know what my scope of practice entails, and I know how I work, and I know how comfortably I work with a certain demographic, probably, with some disabilities or whatever. You understand your scope of practice, and you understand, and you thrive in that.
It's a safe place to like learn your boundaries, right? Like, what can I do? What can't I do? Because in private practice, it's like a rough place to like learn that.
It's a rough place. Yeah, it's a rough place, and like people don't like people who are in the hospital are already, they have some kind of medical or physical or mental compromise in some way or the other, and if you're dealing with that, I think you're ready. I think everyone should do a GPR in my own eyes. I would say, like, this was honestly the best year of my life, not because of the experience that I had, like in terms of, hey, you know what, I can take out any wisdom tooth in the yard, like however impacted it is or whatever, but it's just about how to deal with like different demographics, and that's extremely important. That's especially like Toronto and downtown.
Yeah, you
Toronto,
see a lot of things,
right?
And so if someone's like, we have some Canadian dental students that listen to the show. What would you say the biggest pros and cons of like the Toronto programs? I know obviously you have some interaction with like the Sunnybrook and the children, the sick kids, interns as well, residents, right?
Yeah.
Like the general consensus of the group, what do you think some like main pros and cons of like the Toronto hospital programs would be?
So I would say like it's a very labor intensive. Like I say, it's super labor intensive. There are the best minds out there. I'm not like just saying this just because I'm a grad from Sinai, but these guys they are currently the people that I currently refer to. Like there's Christopher Lee, there's Dr. Tenenbaum, Bruce Freeman. These are people that I refer to, and it actually is a great place to kind of network, get to know people, and possibly they can kind of help you out in a particular case which you're stuck in, or just kind of run it by them, and they would actually help. So like networking is a big thing with U of T, like any hospitals associated or affiliated with the U of T. But I would say like the cons, you learn a lot. Like, let's go back to the pros. You learn a lot. Like I learned wisdom teeth surgery. I learned how IV sedation. That's kind of huge, thing. Yeah. I wasn't. It's huge. Yeah, like it's like 20 grand, 30 grand out there. Yeah. And it's like free of cost with this, essentially. Like you learn that. But it's very good in terms of how much you learn, and your learning curve is so steep. At any of these hospitals, like if you're planning to go into pediatrics, for sure, man, sick kids is the way to go. If you're planning to go into like cancer research, that kind of, managing like a terminal dentition kind of stuff, Sunnybrook is the way to go. Sinai is like pretty much everything, jaw dislocations, jaw fractures, and gunshot wounds, and that kind of stuff, right? So it's very hands-on. It's like your learning curve after school is exceptional. Like, you learn so much. But then cons again, same thing. Like people have different power trips that they're on, and like people have different they're in different spaces in their own heads, and you got to kind of deal with that, and you got to be smart about that. And if you know how to like speak to people, talk to people, network with them, I think you're going to make a more positive year versus a more negative kind of outlook towards GPR.
And so when you wrapped up that year, do you think, how much do you think that having done that 1 year of GPR like helped with like securing a job, and like securing like a good job, maybe that made you a little bit more, maybe like a better candidate or associate than someone like coming fresh out of school who doesn't have that experience, or has like 1 year of private practice versus like a year of like GPR experience?
Yeah. So it's wrong that you asked me this question, because that was the exception to this rule, right? Because I actually was moonlighting during my residency, right? Because I had to kind of make pay my rent, and like living downtown is insane, right? So so I had to kind of have like the day that I wasn't on call or whatever, I used to kind of moonlight at this college at College Park in Yonge, so there was a little clinic out there, which is part of a bigger branch of clinics, and it was great, like, because if I was on call, I used to see about 3 or 4 patients, and that kind of helped me transition my practice into that practice essentially after I graduated from my residency. So it was an easy transition for me, but that was the only way for me. That's how I kind of looked at it, if I wanted to kind of make that extra buck or whatever, and actually transition, like, hey, you know what, this is just like an MOD 2.6 composite, man. Like it's simple stuff versus doing jaw fracture, rigid fixation at 4 a.m. But so it was a great transition for me. So it kept me kind of on my feet, and it helped me transition better into practice. So I kind of created my own little clientele base out of that practice once I graduated from residency, and I still see them, and that's amazing. So I would say, like, compared to someone who's just out of practice, there is a learning curve. There, you will make a lot of mistakes right out of school, and not saying that I'm not making mistakes today, or I didn't make mistakes right out of residency, but it's just a learning process. It's just essentially what you're comfortable doing every day, and what you're comfortable in your practice. Maybe you're not comfortable right out of school to do completely impacted mesioangular 3/8. Maybe it's not your thing, right? But what if you can do tons of endo? What if you can do amazing aesthetic dentistry? But there's a learning curve to everything. Like school will teach you just the basics. I feel like school will gear you up with just the basic necessity to kind of get out there and practice your dentistry. But I know a lot of US schools who are like doing like 50 crowns and
it's crazy,
150 dentures. Like, what are you doing, guys? But comparing to Canadian schools, I don't think we have that kind of exposure.
Yeah, for sure. You learn a lot. Like your first year out, I think, be it in the hospital setting, obviously, like you said, what you guys are dealing with more like extreme sort of
extreme
ends of the spectrum, right?
Extreme case.
Whereas
Absolutely.
If you're in private practice, maybe you're just like stressing out over like a MOD to start.
Exactly, right. Oh my God, this
there's a bit of blood. What do I do? The patient's on aspirin. Is she going to bleed out? Man, that's awesome. And so, how long now have you been working in private practice? Like since the residency's been done?
So since residency, I actually started working like right in the middle of my residency. So 6 months in, I was like, you know what, I gotta make ends meet. I gotta pay my rent, and this is the only way, and this is the easiest way for me, and to transition into private practice. So I've been working for since then. So I graduated in 2016 July. So I would say a year and a half.
Private practice. And so let's talk about like private practice life for a bit. So both of us are pretty green still in that realm. I just recently I'm just in my 13th month now, so I can't really say I'm a first year associate anymore, which is weird. So I get used to that. Now I have some like responsibility. I feel like I'm like hey, I'm in the first year. I don't know how to do this. So now I can't say that. So in your like ideal week of practice, like last week, for example, just talk me through some of the procedures you do on the regular, some things that, you still get a little bit nervous about, like you see in your like in your schedule for like tomorrow, and you're like, oh, I got like a endo on like an upper molar, that it kind of makes you like think like it's just like you're not like just kind of like sleepwalking through it. So talk to me a little bit about those kind of like procedures and like what are you doing on any given week.
So any given week, essentially, like there are a lot of endos. So I'm doing at least like 3 or 4 endos a week. The only thing that actually helps me out, we'll get into that later. Like I'm actually teaching at the school as well at Western, so we'll get into that later. So any normal week, usually I like to keep my Thursdays as surgery days. So I do surgeries essentially all day. So regardless if it's like wisdom teeth or like crazy impactions, and my extractions for my orthodontist who's in-house as well. So that day would be dedicated to surgery, just because they can take the Friday off and the Saturday, Sunday recuperate, and then Monday they were back.
And do you like having it like scheduled like that, so you're like in that oral surgery like mindset for the whole day kind of, versus like
absolutely, man. It streamlined my life, like because I know what to stress about, and I know what not to stress about, and it's like, listen, private practice is hard for a new graduate or for someone who's just kind of within their first year, like me or whatever. It's hard because your learning curve, like I said, it's your experiences that you have within your first year are insane, and they actually make you, they kind of cater to, or they kind of prepare you for the next 40 years, essentially, So it's essential that you kind of get through this process, and you'll turn out to be a much better dentist. But I like to keep it like that, but I don't have like specific endo days. I'll kill myself. But I kind of mix it up. I'll have endo in the morning and then crown prep somewhere in the afternoon, and all my like fillers are pretty much MOD restores or whatever. Just stuff like that. But when it comes to like veneers and stuff, I will dedicate extra time for them, just because I'm not like 100. I'm not like Apple. I'm never gonna be Apple. Right, but it's something that I need some time with, right? Like to provisionalize and to kind of make my little stance and do my little research and kind of do the preps and take impressions my impression has a void, for example, I have that extra buffer.
I think that's critical because I find too, especially with like procedures like this where we're still like learning, right? Like even like for endo, for example, like I can like rush it and like
you can rush it. You can rush everything.
Squeeze it into an hour.
But like everything in dentistry.
Yeah. But I'm like, it's especially when you're learning it and you're doing it for like the first like 10 times, maybe like 20 times. It's nice to have like a little bit of extra time. So at least the time factor is not an issue. Like, like, oh my God, the next patient's waiting. Like,
don't rush. Don't rush anyone. Like, don't rush anyone. Take your time. If the first, like when I was my first day actually after my residency, I was like booking for 2 restos, like 1.5 MOD, 1.4 DO, for example. I was kind of booking like an hour 10, hour 15, which is something that right now, like we do in like 40 minutes, 30 minutes, like prep done, it's done. But give yourself time. Don't rush yourself. Don't rush the patients. It's not fair to them. It's not fair to you, like, because people like, if you consider like I'm teaching at the school and people are just doing access openings for 3 hours. You know what I mean? Like, so like, and it's okay. It's okay.
You have to go through it. We all did it, right?
You have to go through it, man. Once you do enough, you will kind of cross a hurdle and it's just become part of you, It becomes second nature. Once it becomes second nature, then you're
I'm thinking back to like my I'm having like flashback to my first endo in school. And like, man, the story, like, so it was a 1-4, like 2 canals. And literally it took me like 3-hour appointments. So it took me like almost like 9 hours to get this thing done. And I remember
premolars are the hardest. Honestly, premolars are.
We had hard. So I'm trying to get my working length PA, right? So I have my like 10 and 15 files, whatever, in there, and take a PA. And this is like, it's not digital, right? So it takes like 5 minutes. Like you take and you have to like put the X-ray through the developer, and then it comes. So it's like actual film. So I took it. I missed the PA. I missed one of those. I've never seen I missed the apex. I'm like, shoot, like I do something.
Oh,
so take 3, and then finally I go back to like adjust something. I come back. I take it. I developed the film. I get the apex, but I realized I took out the files by accident. So I was I ended up taking like 6 PAs for this poor woman to like make sure I got my working. It's like disaster.
Dude, it happens. It happens to everyone. It happens to the best of us. It happens to like everyone across the board. So you're not the only one. I've like when I remember my first endo that I did like in private practice, essentially back in Bombay. Like it took me years to do that. Like like it was. I was using hand pro tapers, and those things fracture. Like even if you breathe on them, like and it was hard, and like but. There is like once you know how the file works for you, once you've kind of developed your own system, because you're using a school system, there are so many things out there they're not teaching. Like they didn't teach me gutter core at Western, right? They taught me downpack and backfill with like your Massacone and like with molten gutter perch or whatever. That's not what I'm comfortable with. Like I can do it, but I'd rather spend 5 minutes doing a gutter core obturation versus do something which is taking me like 20, 30 additional minutes, so you find what's working for you. You find what you're comfortable with. Take CE, dude.
And like you said that earlier too, like that first year is like critical in like setting you up for like your career, right? So I'd heard that, and like I'd had this in mind. So I'm like, I was really stressed this year. I was like, what if I have like a bad year and then like my whole career is like going to be like terrible? So I put a lot of pressure on myself to like learn everything. I was like fully into it, right, this whole year. So what after you've obviously like in residency, like you're just getting free CE, like you're doing your IV sedation, like you're learning some surgery. I think you guys like an implant course or something like that too, right? And that kind of like
there is an affiliated Straumann course which allows you to place about 3 or 4 implants, which is not much, but it's still something, right? So you do it under supervision, and it's not
in that year now that you've been out of the GPR world and in the private world, how did you prioritize like what CE you do, and like what have you done so far, basically?
So CE for me is like, I think all my money that I've spent is on CE. Like whatever I save, whatever I'm making is essentially goes towards CE. You know, like but it's like I like to do, or I like to focus. So people, let me get to this. People like to focus on things that they're never going to use, right? People love to do all the CE with, like, you know, sleep dentistry and like, you know, learn about REM sleep and stuff. Like, how many patients do you walk through your door with regards to, you know, like, and how many screening process do you have in-house to kind of screen them for any sleep disorders or whatever? Like, people are doing all this stuff, like, you know, like, let me do an advanced endo training course, which helps me help like bypass files and stuff. And you know, these guys are not even doing like straight
upper central, like, or something like
upper central, exactly, right? So it's like, take CE, which is relevant right now, right? It's right here, right now. It's not about what you're going to do in the future. It's not about what you're you know, potentially going to incorporate in your practice. You're still an associate. You're still like doing daily procedures, bread and butter procedures, which are gonna actually build your clientele and build your repertoire with whatever your patients and stuff. It's concentrate on something that you're good at, or concentrate on something that you're not so good at, but you're doing every day. Right? Don't spend your money on something which you're never gonna do. You're never gonna screen patients for it. You're never gonna introduce that, because your office or your facility doesn't have that kind of groundwork to kind of do, for example, IV sedation. Like, don't put yourself into that if your office is not IV sedation certified, right? So it doesn't make sense. Like, people are like, you know, spending so much money on, hey, you know what, I'm going to do all these veneer cases and I'm going to do all this, like, you know, felon seminars or whatever, you know what I mean, right? Like those kind of seminars, and they don't do veneers in their practice. Yes, they want to do it. Yes, they want to learn it. But there's a massive disconnect between what you want to learn versus what you're doing every day, you know? So I take seminars, I take CE, I take all these webinars or whatever based on stuff that I'm doing. Like, I'll do a decent bonding, right? Like, I'll do like for my crowns, for my zirconia, for what material should I use? How should I temporize my my crown preps, or you know, like my endo, like gutta core. I took gutta core like a couple of months ago with Manfred Friedman. But you know what I mean? Like, it's like something that I want to kind of implement tomorrow. It's not something that I want to implement, like, exactly practical stuff, which makes sense to you. Invest in that. Yeah, it's not about, like, no one's going to teach you how to kind of carve out an MOD beautifully or whatever. No, it's about there's so much to it. There's so much to it. I took Lee Ann Brady. I don't know if you've heard of her, Dr. Lee Ann Brady. This was at AGD last year. She's an amazing restorative dentist, and I took her course at the AGD, and it was amazing just because of the stuff that she kind of the like something like pre-wedging.
Oh,
like,
man, that's changed my life.
Dude,
it's the best thing ever.
It's the best thing ever.
Like rubber damming and then pre-wedging, and then your life is like easy. Like, I love it, man.
Dude, it makes life so much simpler for you. You know, like, there's no nicking of your papilla. There's no blood there. There's like, it's just a plain, clear field.
Do you use when you're doing like an MOD or something, or MO? So you're using sectionals, right? And so now that I've been pre-wet, like, it was actually funny because you mentioned this, like you do a filling like 10 times a day, and you kind of just like get into the routine, and you kind of like just do it as like a step, so you don't really think.
Right.
And a couple nights ago, I was like on YouTube, and I was like, oh, let me just watch like a video on like sectionals, like not even like a clinical one, just like the one from the manufacturer, like how to use like the sectionals.
Sure.
And they're talking about like how you can like slide the wedge in most of the time with, you can slide the matrix in most of the time with the wedge already in place. And it'll kind of like just snap in, and it's like perfect. So do you normally do that, or you take the wedge, like when you pre-wedge, you take it out, put it in, and put it back in, or?
100%. So like I'll take out my pre-wedge, I'll put my matrix in. So I only use Triodent. I don't know if you guys have heard of it, or there are people out there who like contact your manufacturer, buy this product. It's gonna like, I wish I got some royalties saying this, but dude, that product is amazing, and it's helped me out in so many more challenging cases. It's called Triodent, Triodent. So they have these perfect wedges. They have perfect sizes. So depending on how your contact is, depending on how you broke your contact versus you didn't break your contact, your wedges. So I'll take out the wedge. I'll put my matrix in. Put the wedge back. The same wedge essentially. So so I'm not wasting obviously resources and less landfill, I guess. So.
The green dentist is good. And what about okay, let's we're just like kind of scattering around, but it's nice because this is like things that we'll all think about it, a day-to-day thing, practice, right? So you mentioned gutter core. I like it. I like it in the sense that it's like it's easy to obturate, like you just kind of, and it works well, and you always get like a little nice puff as well, and you're like feeling good. What I don't like about the gutter core system or the what's the other one, thermofill. It's like the cleanup is like the chambers.
Oh, the cleanup sucks. Oh yeah. Like, that sucks, man.
Like, what's your tips?
Don't worry.
And how do I?
It sucks for everyone. So what I do is essentially when I pack, when I kind of, so I count to 10. The moment my oven beeps, so the Betty Crocker oven that we have, right? So the moment it kind of beeps, and the time that it takes for kind of taking it out and placing it into the canal is about 10 seconds. So I actually give
How do you stay calm? I'm like, when like in this time, man, I'm like nervous. Like I'm like, my hands are shaking. I'm like, what if I miss? Because you know, like the gutter core like crumble, like kind of like if you miss if you like hit the floor,
you miss it,
like it's game over, and like and then you're creating waste and wasting resources. Like
no, for sure. I
get so nervous. So I'm like anxious, man. I'm like getting it. It's like.
No, for sure. It happens to all of us, and there's nothing wrong with that. Gutter core it's hard. Like the way they've kind of manufactured that, it's way better than thermofill. Is just because
it's GP.
It can be retrieved. Retrievability is a big thing in endodontics now. Just because we're doing half-ass root canals and they don't work. But so the gutter core has alpha and beta phase, and like that's why it was created like that, right? So the essentially the surrounding alpha phase or the beta, I'm not too sure, but the surrounding gutter core is supposed to be molten, but the middle part, which is I think the beta phase, is supposed to be like rigid, right? So that's actually
keeps the shape,
carrier. Keeps the shape, right? So unless you have straight line access, you're never going to get a perfect obturation. Unless you're like, if you feel that your files are kind of bending, like you're doing all this ninja access and all this conservative access stuff, it's going to work for an endodontist, like, you know, but for someone like me, it doesn't work for me. I need a bigger access. I'm not doing access, like, if I need to do an access through a crown or whatever, I need to know where I am. I need to see the dental map. I need to see how much dental ledges are around my orifices, and I need to kind of like take that out with a gate skillet and that kind of stuff, right? So unless my files are not going in straight, I'm not essentially I'm not doing putting the gutter core in there.
And then
I take a deep breath. Take it out from the oven. No pressure, man.
And then so you seat it, and then you count you count to like 3 or something as you insert it, like slowly, or like kind of thing.
Yeah, so it's a full count to 10 from the oven
full
to
length,
the canal to length, and then I kind of hold it, right? So I hold it with my finger, or I'll hold it with the cotton pliers that I'm holding it with. I'll hold it there, let it kind of solidify, let it kind of harden, and I'll leave it there. Once that is done, people say take a burr and cut off the top part, or take a high-speed diamond or something and cut off the top part. I don't feel comfortable because I feel that it can dislodge, and I'm taking on more tooth structure. What if what if I slip, or what if I don't want to be taking on more tooth structure that I have already taken out, right? So like, as long as I have straight line access, as long as I'm kind of counting to 10 from taking it out from the oven to delivery and obturation, I'll hold it there. I take my long, spoon excavator, right? I take this,
smart.
the endo spoon excavator there, right? and I just kind of scoop it out at once it's hard, once it's kind of set, I take it out. I kind of push the actual stick, which is kind of sticking out of the orifice,
it comes off pretty clean,
and I just kind of scoop it off. Yeah, because that's how I've been kind of using it.
Okay, that's good. And then what about, so if you're saying like you're doing like a molar or something, so there's like, you know, a few orifices, do you put like paper points in the other ones or something, so you don't get like GP going in them before you?
Yeah, sometimes, but it's like, for example, if it's MB1 and MB2, 100% I'll put MB2 as like, I'll put a paper point in MB2 up to MB1 first, and then I'll go to take it out and put it in MB2. But like if it's like very close canals, like if it's like MB and then ML, which are like 3 miles apart, I just kind of
just do it one at a time. Yeah.
That's
good. I need to. I was talking to someone on Instagram about this too, and they were saying like, they. I think it was Daryl Turkillis, like Barbells and Birds. I had him on the podcast earlier. Yeah. So he was saying that he's been going a bit slower as well, and it's like helped out with less like extrusion at the end as well, like less of a puff. Yeah. And I was telling him the same thing. I'm like, I get like really angsty, like in that as soon as it comes out the heater, I'm like nervous to like get it in.
You just shove it in, like, right? Like, no. Like, dude, restrained. You gotta, right?
I get too amped up. Endo, like I love endo, man, but like I get so stressed. It's like stressful. Anything that happens that's like slightly abnormal or like I haven't seen, like my heart's pounding. Right. I'm like, what did I do? Did I like perf? Did I do this?
Dude, look at my hair. Just look. There's a reason for that. So no, man, I completely understand. It's like, you know, we get antsy and we get like, hey, you know, I want to get ahead of myself and I want to like, you know, obturate this perfectly, and so there's nothing, dude. Go slowly. Go slowly. That's the beauty about core, and that's the beauty about like it's all about controlling the movements and controlling the time that it takes to actually obturate the canal. So like you're kind of if you're shoving it in, maybe you're short, maybe it buckles on you, or maybe it's like, you know, breaks on you, or you're in a different orifice whatsoever. Once you kind of line it perfectly onto the orifice, it's a smooth movement.
It's nice. Well, it's a nice system, right? For sure.
And let the hydraulic pressure act for you. Like, don't create hydraulic forces unnecessarily. Let it act, right? So once it's kind of molten, and if you shove it in right away, I don't know if you're going to fill any laterals or not, or give it time to fill any laterals. But I find that like when I go slower, I actually
I'm able to it looks nice, and then you're happy afterwards. What's your emotions like from after you obturate until you get that PA? Like, are you nervous at all at this point, or are you like pretty confident?
I would say like, see, the thing is, if I get more nervous when I see students fill at the school, but I think I'm over my little hump of obturating and getting perfect, because I only take 3 PAs during my entire root canal process. So it's master cone or it's master file to apex, and then the final fit. So
you have like for the gutter core, you have like the verifiers. Is that what you use?
Yeah, I have the verifiers in canal and in the canal, or before, when I did not use gutter core, I used to use master files or master cones. So they used to go in there, and I used to take a PA, and that used to be my reference, right? Because there are in school, the way we've been taught is like take about 25 PAs for one lateral incisor or whatever, like it's unnecessary.
And then do you take often, like, what's your trust factor with your apex locator? Like, do you take working length PAs, or are you just kind of like?
I take some, like, because my master apical file radiograph or my size verifier radiograph will actually show me if I've prepared or not, right? So that's essentially what I use as reference. But I use the Coltine whale dent one. I don't know what it's called. I think it's Apex Pro or something. But it's been super reliable for me. It's been my workhorse. I used to use the J Marina one before that,
Root ZX or whatever.
But it was like that big, it's not reliable. Like it just doesn't.
It's too jumpy.
I don't know. I just too jumpy. Yeah,
that's cool. And then what else? Let's talk a bit of crowns. So we had dinner last week. I told you about this crown that I cemented in, and how'd it go? Oh man, that shit was fine. I was so stressed for no. I told the, right? So for the listeners, like what happened was I zirconia crown on like lower first molar 4-6, and I cemented it in. I must have got some bond or something on the 5, like adjacent to it. Now when I seated the crown, by the time I went to like floss through the contacts, like it hardened a bit. So I think I bonded a little bit, had a bit of bond in there or something. And I couldn't floss through. So I was getting a bit stressed. I put like a wedge in. I tried to use like a soft flex.
And this is what we're talking about.
I tried to put a run through a soft flex disc to like open the contact. And because I didn't have those little like metal finishing strips, like the serrated ones to like break the contact breakers. So I got a little bit antsy and I took a mosquito burr and kind of like cleaned up. And I was worried I took too much off and like left the open contact. So the whole week I was stressed. I was telling Rahul at dinner, and luckily I saw the patient for some other crown preps last week, and he's like, "No, it's totally fine. I got the floss through." And I checked, like it's a light contact to be fair, but like it's still like a bit of a contact in there. So I was like, thank God. And he wasn't complaining of any food impaction or anything like that. So I was like,
unless you, I just feel that in practice, unless I'm leaving, a contact of about 1 millimeter. That then I find 1 millimeter or more, then that's an issue. But I feel that if the contact's more than about 3 or 4 millimeters, there's just food. Your tongue can kind of just sweep through and take all that food out. But if it's like anywhere between like 0.5 to 1 millimeter, that's what I find.
The annoying.
That's like the that's the critical.
I remember that in school. If it's like a big contact, like you're doing them more of a disservice, like trying to close it and like being just short. You might as well just leave it open 100%. And just.
You're having an under like an overhang, not an overhang, but like an unsupported filling. Yeah, over contoured filling. It's like, is it worth it? Like I don't know, man.
All right. Yeah. So last thing I want to sort of touch on with you is because I really like the way like you communicate. Like you're very like good speaker and stuff. So I want to see, and this was something that I haven't really talked to anyone about on the podcast, I don't think, is like the dentist and like staff interaction, right? Because I remember like when I first graduated and I was working, I wasn't sure like what the etiquette is. Like, am I supposed to be like friendly, like talking like, you know, like I talk to my friends, or am I supposed to keep that like professional boundary? Like there's like a real like struggle for me to like find like a good balance and stuff. So what's been your experience, and especially because we're younger too, right? So a lot like our assistants maybe like if they're a similar age, they're just thinking like we can just be like buddies or like be best friends, which is like there's nothing wrong against it. But I just wanted to see like what your experience has been with staff interactions.
100%. First of all, it depends who it is.
Yeah.
Right. Like it depends who it is. Like if some people are on their power hungry trips or their ego trips or whatever, you're never going to be like one-on-one with them, or you're never going to be friendly with them. And people have different personalities. Yeah. Like, you know, people in an educational setting are different from people outside. People outside like are, I just feel they're, I don't know why I shouldn't say this, but anyways, I shouldn't say this. I just feel people are more approachable outside. Outside, and like, you know, when they're not associated like with an educational setting, or when they're more approachable. They're more verbal about their successes and their downfalls essentially, and they're more. You can communicate better with them, and you can like kind of relate to them better, you know, like because you're kind of going through that process yourself, right? And they've already been there, done that, kind of, you know, screwed up or you know, buried their face in the pillow kind of thing. They've already done that, and they've moved past that, and they've become better dentists than they were before, right? So I just feel that they're more relatable. Like my surgeon, like I work with Christopher Lee very, very closely. He's my surgeon at Crescent All Surgery. So I'll essentially send patients across the city. It's like a 40-50 kilometer drive, you know, to them, just because I have that much trust in that guy, and he's treated my wife, he's treated my in-law, whatever, right? Like, and I just find him to be so approachable and so down to earth, and so it's a humbling experience for me. So I can tell him everything that I need to, or if I like I can relate to him. I can speak to him. I can speak my heart out, whatever. I can, and he can kind of help me out of a tough situation that I've put myself in or whatever, right? Not that it's not happened yet, but not asking for it. But it's just that I just feel that some people who are find like Dr. Bruce Freeman said, like, find mentors. Like you don't have to find mentor. You don't have to like have a physical person in front of you who's mentoring you or who's looking over your shoulder, who's breathing down your neck. Just go to Instagram.
Instagram's crazy.
Like, Instagram is my biggest. Instagram is my biggest mentor, man. Like the stuff that I'm learning about, or the stuff that I'm seeing, and stuff that these guys are posting about, like PRF and all this like new age stuff, like with all these anterior ramus bone grafts and all this stuff that I'm like following on these. It's insane, right? Like it's amazing that how dentistry can just be so like close to you. Like it's essentially like you don't have to kind of travel the globe, or you don't have to kind of take all these CE courses all the way in like the Dominican or Italy or whatever, and like you don't have to do that. Like it's on Instagram. Just open up a page and you'll learn so much. Like I said, like I told you last week as well. Like there's this guy called Abu Ali something. I'll message you later. I'll put it on the podcast. But that guy references so much stuff from the Journal of Endodontics. He references, like he will have like he will actually type it out, or he'll have like screenshots of the journal or the results or the conclusions or whatever, or the abstract. That's insane. Like that's free CE for me. I don't need to take CE for endo ever, right? That's so awesome. This guy puts stuff up, and I learn.
I love the community, man. You learn so much. You can post a question, people answer. You can post an X-ray and get opinions from like specialists from around the world. Like whenever before have we had like such access to it, right?
Dude, we're so lucky. Like we're honestly so lucky. Like to first of all, you putting out this podcast, getting people on it, like Freeman, and like getting the other guys on it, like fantastic work, and it's amazing, dude. Like it's so relatable. Like we nerded out today, right? Like
I love this. I want to do this. I love doing this, like because and like I said, one of the reasons I wanted to, like, certain people, it's like a job for them, right? Like dentistry is a job, and they'll go to work and they'll do what they got to do, and then they'll come home, and then like they have like other passions, which is like cool. Like there's nothing against that, right? Nothing wrong with that, like at all. But few people are like wired differently. Like I think you're the same. I'm the same. A lot of other people that I talk to are the same. Where like we love it. Like we're obsessed about it. We want to get better. We think about it outside of like we stress out about like open contact for like 4 days. I was literally like I talked to like 12 people. I'm like, like you know what I mean? So it's cool, man. Like I think there's a space for us to like improve and collaborate and learn from each other, which is awesome.
100%, man. 100%. And yeah, like even the photography, like what the reason why
that's the next thing we gotta learn. I gotta get better.
Was like I need to take Aguilar or whatever, what's his name, Jesus Santos or something. Jesus, whatever. So we need to take that.
We'll sort it out.
Like those guys, it's just you're more critical of your dentistry. I just feel that like because of photography, you can zoom in as much as you like and look at your margins, look at your work, look at your hue, look at your value, look at the color that it's maybe an anterior, maybe you're doing a single central, which is essentially the toughest thing to do. But
I have a good one with that. Like I have my camera. I've been taking some pictures, and I had this patient came in and he was having like sensitivity after filling, and a little bit bite sensitivity. I was like, "What's going on?" It wasn't very deep or anything. I was like, "It's a bit odd." So I took the filling out. I was like, "I'll just redo the filling, and maybe it's like a bonding issue." And just for that case, I was just taking pictures, just to like, not even to like assess the tooth, but just to like, as I do like for Instagram, just like post some restorative stuff. And then like a couple of weeks later, I was like uploading the pictures from my camera, and I on that picture I kind of zoomed in, and you can see like a little crack line like going like down towards like the pulp. And I'm like, man, I bet that's causing the sensitivity.
That's essentially
like,
it,
and
right?
Then, so I called the guy. I'm like, listen, I was like looking at some pictures I took that day, and I think there's a bit of a crack in your tooth, and that's what's causing it. So he comes in and I had to be an endo. Like was cool. I was like, I would never have caught that.
Awesome, right? You would never, dude. First, invest in a good camera. Okay, this is for every listener out there, man. Like whoever's listening to it, invest in a good camera and invest in good loops. Like loops are gonna set you like. Yeah, it's not about, hey, you know what? I have like 400,000. I'm 400,000 in debt or whatever. I don't give a shit. Like honestly, like buy good loops, invest in good loops. Don't buy the stuff which the people are like the school is kind of are selling you essentially. Y'all get a good deal through whatever, and definitely don't buy it through Amazon. Definitely don't buy it through
Alibaba and like.
Go out there.
Spend some money. Yeah.
You guys are smart. You guys are in dental school. Go research. Like I made the best investment in my life. I bought these oroscopics recently, and I can switch from 3 to 5 to 4 to 5 times magnification, and I can like it's like I can look at the moon, dude. Like I can see the craters out there. Like honestly, I can. Seriously, it's improved my dentistry. It's made me more critical of my work. It's made my dentistry so much better, so much more like seamless. Because my lab guy is essentially my best friend now.
That's nice.
He's you should get
we talked about that. I'm gonna reach out to him. He got me in touch with Dr.
He's a shy guy, but I don't know. He's a great guy.
For sure.
He's so he's the guy who comes and gives me like feedback, positive, negative. I don't care, man. Like give me feedback. I need it. I need to be better for you as a lab. I need to be better for my patients. I need to be better for myself. And I think if you can't visualize, people talk about, your back and your neck and your wrist and your elbow and this. It's about your eyes, man. I feel like it's all about your eyes. If you can't see, you can't do.
Man, one day, like a few months ago, I forgot my loops one day, and I had to. I was like, I couldn't see anything. I was like, it's dark. I felt like I was like it was like the worst day of my life, man. I was like, I can't see anything.
Like chair light is not enough. Like
you see these older dentists and they're like 70 and they don't wear loops ever. I'm like, how do you even like function? Like,
how do you do it, man?
It's crazy stuff, man. Awesome, Rahul. It's been fantastic. A lot of good stuff. Hopefully, we'll do another one sometime soon. We'll see how you're progressing.
Absolutely.
And I think it was a great episode. I think a lot of good nerd talk, dental talk in there. A lot of people will appreciate. And I want to try and do a bit more of that versus more of the business. Like I think I veered a bit away from it for a little bit. But it was nice. I sometimes I listen to like my first episode that I did, like the intro, just to see like what my original intention was, right? And I want to get back to that and grow it that way, because I think that's more pure and that's more like who I am and what I want to do. So
that's awesome.
I appreciate it.
Yeah, you're amazing, man. Like you're honestly like so real, and you're such a great host, dude. Like seriously, it's like the people out there are actually benefiting from this. Like like I said I think in the beginning of the podcast, like people who are just about the business and the entrepreneurs and this and that and managing overheads and it doesn't relate to me, man. I'm an associate. I don't care. This stuff, right? Like the stuff that you're doing and the stuff that you're putting out there is
Thank you, man. I really appreciate it. Thanks again. We'll do it again soon.
Thanks for having me. I appreciate it.